decline. So to sum it up, what I'll tell you something is, what has been presented is a certain type of peak, but it is only the peak of the picture from our expanded surveillance. We are not measuring the spread of the disease, and therefore we are not able to tell what the peak of that spread is and where we'll be going from there.
We cannot say that Dr. Bedusa Akodie was wrong about this. What is a peak? What is the standard definition for the peak? And, you know, people, including Kwame Sapong-Asiedu, have said it is a mathematical definition. And that definition is when your daily recoveries are more than your daily infections. So this graph, which tells us about advanced surveillance and, you know, samples that were taken long ago and don't get, you know, results within the same day, and to on that basis say we have peaked and expect to decline. Will you say that was a mispronouncement on the part of, you know, the team?
Samson, I think that's a great question, and let me come back to what I was talking about, which is the presentation of the picture. So the picture was presented by the Ghana Health Service, which I must say is an accurate picture based on what they have available and what they set out to do, which has been this enhanced, you know, tracking, testing, and treating. And when we speak of a peak in epidemiology, and I can tell you because I teach this as part of my work at KNUST, you can have many kinds of peaks. You can talk about the peak in terms of the rates of death. You can talk about a peak in terms of the rate of infections. You can talk about a peak in terms of rates of recovery, and in so many other ways.
What did we understand? What did we understand Dr. Bedusa Akodie to say in this regard? What sort of peak did he speak to?
I'll tell you what it is. I'll not tell you what he said. I'll tell you what it is based on the graph because I can interpret it. And what I'll tell you is that this is reflecting the picture of those who were contact traced, those we have actively surveilled and looked out for to a large extent. And this picture is only showing these kinds of people. We have not, and I stress again, we have not measured our rate of spread of the disease.
Right.
And really the most reliable kind of graph that you want, for which you can begin to speak of a peak and talk about a decline eventually in your infections, is in relation to the rate of spread of the disease. And this is when you want your reproductive number to go below the 1. This graph does not give you this information. And the comments that he passed regarding the peak were comments on this graph.
Okay. Let me